think about healthcare, you might first think about the expensive acute care that we read about in the headlines. But if you ask family physicians, they'll tell you that 90% of your healthcare is in the community. But really, who provides almost all of your healthcare? It's not doctors, it's not nurses, or other healthcare providers like me. It's you. Real healthcare is self-care. The best predictor of your future health are the habits you practice today. So the 4 foundations of good self-care are what you eat, what you do, how you feel, and how you relate. What do you put into your body, both healthy and unhealthy things? What do you do with your body? Physical activity that supports all the activities of daily living and helps you do what's meaningful for you. How do you relate to other people? How do you connect at home, work, and school, and with society? And finally, how do you feel? How do you recognize your emotions and how do you manage them? And how do you live a meaningful life? The doctors who compose the divisions of family practice care for our patients in our practices, care for you individually, but now care for our community as a whole. And we're involved in other stakeholders in providing the best healthcare that you can have and to make you the best self-care provider. Let's talk about the key respiratory symptoms. So the respiratory system. So are you having difficulty breathing? So there is some overlap with the cardiovascular system. So this could be due to asthma, chronic lung disease again, anemia, heart disease, heart failure, or lung cancer, or being out of shape. Are you wheezing? So if you don't have asthma or have kids with asthma, you might not know what a wheeze is, but it's a musical sound when you're breathing out. So some people can hear it audibly, we hear it with stethoscopes, and this is without using the kazoo or the clarinet. It could be a sign of asthma or bronchitis, but we're taught in medical school that not all that wheezes is asthma, so it could be some obstruction in the bronchiole. It could be due to a tumor or a mass, so we always check that out. Have you been coughing? Well, pretty well everyone that survived the last fall and winter has gotten the cold at some time and coughed for about a month or 2 months. So coughing could be caused by anything that is affecting the respiratory tract from the back of the nose, down your throat, into your lungs. So anything that's tickle or irritating. So it could be a cold, it could be allergies, it could be postnasal drip, it could be acid reflux from your stomach that irritates the larynx and causes the cough. It could be from asthma, again bronchitis, it could be from infection, and it can be from cancers in the respiratory tract, especially if it's not getting better as it should. Of course, there'll be other symptoms of lung cancer like weight loss or coughing up of blood. So it's not just the coughing, but have you coughed up any blood? So if you just had a nosebleed, that could be a cause, but if you're not sure, do check it out. Commonly, it can be just from a minor broken blood vessel, but if you're older, if you have a smoking history or been exposed to a lot of pollution, then you definitely do want to check out to make sure it's nothing more serious.